Hi, I'm Dr. Shukla. We're going to add to our discussion about heart failure by talking about some of the new agents that we're using in this area. Now here's the list of all of the medications that we had been talking about. I'm going to focus on something called the funny channel inhibitors. If you've already watched our angina lecture, you'll have some inkling of what we're going to be talking about. Ivabradine is a well-known agent that has multiple names in other different countries. You can have a look at the list of trade names in different countries. Bottom line, this is a medication that allows for the treatment of heart failure by improving the dynamics of the heart. Adverse events of this particular agent include luminous phenomena, which I've discussed in the angina lecture. It's where people feel like they're walking down a bright hallway, or lights seem a little bit brighter with a bit of a haze to it. It's a very unique kind of phenomenon, and I think that this is the only drug that I can think of that has this type of side effect. So when you're looking at your exams and you see luminous phenomena, look for this drug and it may be the correct answer. Side effects also include bradycardia, atrioventricular block. You can get dizziness, possibly from low blood pressure or from low heart rate, and you can get blurred vision, which is separate. We do use this medication for heart failure, but be careful in using it in patients who have sick sinus syndrome. Be aware that this medication has interactions with the 3A4 inhibitors, such as ketoconazole or some of the macrolides. Be aware that you may have a drug interaction with verapamil or diltiazem, which are calcium channel blockers. And be aware that this medication, when we're using it in heart failure, should have a little bit of reserve. So use caution when you're using this medication in heart failure. The next category I want to talk about are the neprilysin inhibitors. First of all, let's define what we mean by neprilysin. Neprilysin has many different names because different researchers found out about this protein and called it something different based on their area of specialty, and we now know it's all the same molecule. Other names of this include the membrane metalloprotein, or MME, a neuroendopeptidase, cluster of differentiation 10, or CD10, or common acute lymphoblastic leukemia antigen, or CALA. So all of these different names refer to neprilysin. Neprilysin is a zinc-dependent metalloproteinase that you can see here in our image, and it breaks down natriuretics. So if you think about that, anything that breaks down a natriuretic will enhance or make worse heart failure. A natriuretic is something that makes you excrete sodium, and when you excrete sodium, you excrete water, because water follows sodium. So some of the natriuretics that we talk about are atrial natriuretic peptide. ANP is released when the atria are stretched out. They're stored in these kind of black granules inside the atria. And when you have heart failure fluid overload, the stretching of the atria releases ANP so that you release sodium from the urine. A BNP, or brain natriuretic peptide, is also released during heart failure, and you're familiar, I'm sure, with BNP because it's one of the agents that we're measuring to try and determine if a patient is actually suffering from acute heart failure. Vasodilators are also broken down by neprilysin. That includes certain bradykinin vasodilators, and that includes certain adrenomedullin vasodilators. Finally, other agents that are broken down include glucagon and these other substances that I'm not going to get into too much right now. Now, the very first of the neprilysin inhibitors was a drug called omapatrolat. Now, it ended up being withdrawn because of very significant angioedema and significant side effects. So we thought that this sort of category of drugs was dead when omapatrolat was taken off of the market. But along comes a drug called sacubitril, where what they did was they took omapatrolat, they altered a couple of methyl groups, moved a couple of moieties around, and they come up with this new sacubitril. Sacubitril is almost always combined with valsartan, and it is being sold commercially in the United States, Canada, and other areas as Entresto. Now, Entresto is using a combination product to treat heart failure. So here you see an example of a patient with an elevated JVP. This patient has clear evidence of heart failure. This is actually one of my patients. What we do is we take the angiotensin receptor blocker and we take the neprilysin inhibitor, we put them into one, and generally speaking, these combination products have an acronym called ARNI. Currently, Entresto is licensed for use for heart failure with a reduced ejection fraction, or HFrEF. Generally speaking, we're talking about ejection fractions less than 40%. However, in the future, we may see use of this drug with people using higher doses of these particular agents. Now, in terms of the benefits of this agent, we know that if we take people who are currently being treated with current levels of appropriate therapy, which are ACEs and ARBs, and we switch them over to Entresto for 2 to 3 years, we end up preventing 3 deaths from heart failure, 5 hospitalizations for heart failure, and 11 hospitalizations overall for other related illnesses. So we know that Entresto reduces significant morbidity and mortality. But I also want to point something else out. From a clinical point of view, as a doctor who uses this medication all the time, I am shocked at how much people feel better. People come back and talk to me and they say this is the best drug that they've ever been on, and they're able to breathe and they're able to do more physical activities. So I think that what's going to happen probably in the next 10 years is we're going to see this medication being expanded, not just to patients with heart failure with reduced ejection fraction, but heart failure with preserved ejection fraction, or what we call HFpEF. Side effects of this medication, number 1, is cough. Another potential side effect is angioedema, although it tends to be relatively rare, especially when you compare it to omapatrolat. Renal failure is a potential problem, so be aware that you can't initiate this medication in patients with significant renal failure or renal impairment, and be aware that you can precipitate renal failure because these are potentially renally acting drugs. You can cause low blood pressure predominantly because of the valsartan side of the combination product, but neprilysin inhibitors themselves can lower blood pressure, so that's a potential side effect as well. Finally, you can have an elevation in potassium levels. Remember that valsartan, in the combination product, also raises your potassium levels. It's something to be aware of. We have to use these medications with caution. We have to wash out patients who are on ACE inhibitors. If you give Entresto to a person who is on an ACE inhibitor, you can have dangerous elevations of bradykinin. So be aware that we need to wash out patients for at least 36 hours prior to use. In my clinical practice, I tend to wash people out for about a week before I initiate Entresto therapy. The other thing I want to mention is that the neprilysin also clears out amyloid beta protein from cerebrospinal fluid. This is an important consideration because we know that amyloid beta is implicated in Alzheimer's disease, so we want to make sure that anything that inhibits neprilysin doesn't exacerbate or make worse the Alzheimer's. We don't see any signs of that at this point in time, but it is an area of research that we're keeping an eye out for, so I want you to keep an eye out for that as well going forward. Okay, that's it. That's some of our novel agents used in heart failure. I'm sure that you'll do really well in your exams. Go show them what you know.